Hello friends, how are you? My name is Rizwan Hafiz, and in the previous videos we were talking about the peptic ulcer disease. In this video, we will talk about the anti-ulcer medications, their mechanism of action and their pharmacology. So first of all, let me tell you about different types of cells present in the gastric pit. Here is a gastric pit, and here you can see these are the basically parietal cells responsible for the secretion of HCl. These are basically enterochromaffin cells responsible for the secretion of histamine. These are the fabulous cells or mucus cells responsible for the secretion of mucus and bicarbonate. Okay, in the previous video I have explained in detail about all these secretions of these cells and how these secretions will be regulated. I have also talked about the cellular mechanism of these secretions. Okay, so if you want to learn more about this secretion and their regulation and their cellular mechanism, you can visit my those videos. Link has been given in the description. Okay, so before moving toward the medication, I would like to give you a brief summary about these secretions so that you may get better concept about the drugs, how they will act and how they will control the acid secretion. So first of all, here you see enterochromaffin cell is basically responsible for the secretion of histamine. Okay, and now this histamine that has been released from the enterochromaffin cell in response to gastrin and in response to acetylcholine. It means when acetylcholine and gastrin, they will act on the receptor present on the enterochromaffin cell. They will stimulate the release of histamine from the enterochromaffin cell, and then this histamine will act on its receptor, H2 receptor, that is present on the parietal cell. And when histamine will act on its parietal cell, it will increase acid secretion from this proton pump, from this potassium hydrogen ATPase pump. This pump is basically responsible for taking hydrogen out of the cell into the lumen of the GIT and taking potassium into the cell. So basically, and this when the hydrogen will come out of the cell, it will react with chlorine and it will form a HCl. So we can see that basically this pump is responsible for the acid secretion. This pump is also called as proton pump, and it is also called as potassium hydrogen ATPase pump because it needs ATP for its function. Okay, so this is a ATPase pump. Well, now let's talk about the cellular mechanism, how histamine will stimulate acid secretion. Let's talk about, well, detailed mechanism has been explained in my previous video. I will give you a brief summary here. So what will happen when histamine will go and it will act on its H2 receptor. So now let's talk about a bigger picture of the parietal cell. This is the parietal cell and this is a bigger picture of the parietal cell. So when histamine will act on its H2 receptor on the parietal cell, what will happen? With the help of G-stimulatory protein, GS protein, adenyl cyclase enzyme will be activated, and this adenyl cyclase enzyme is basically responsible for the conversion of adenosine triphosphate into cyclic AMP. Okay, so cyclic AMP level will go up, and when cyclic AMP level will increase, it will activate protein kinase A. And you know that protein kinase. What are kinases? Kinases are basically those enzymes that help in the phosphorylation of other proteins that are basically responsible for attachment of phosphate group on the other protein. So this is a kinase protein, protein kinase A. Its name is protein kinase A. So this protein basically attach phosphate group on another protein, and the name of that protein is ezerin protein. Ezerin protein basically belong to class of cytoskeleton proteins, and when this ezerin protein will be phosphorylated, it will get activated, and when this protein will get activated, it will help the fusion of tubulobasicles with the plasma membrane of the parietal cell. Now what are tubovasicles? Tubovasicles are small organelles, and they are present in the parietal cell. On the membrane of these organelles, proton pumps and potassium channel are present. So what will happen? This ezerin protein will stimulate will increase the fusion of these tubovesicle with the plasma membrane. So it means this is erythropoietin protein is basically increasing the number of proton pumps on the plasma membrane, on the cell membrane of the parietal cell. When there will be more proton pump, obviously more acid secretion will take place. So it means binding of histamine is basically increasing the number of proton pump on the parietal cell membrane, and when there will be more proton pump, more acid will be released. So we can see that histamine, when it will act on its receptor, it will increase acid secretion. How acid secretion will be increased, I have explained in the with the help of cellular mechanism. Okay, so what in 1977 antagonist of histamine was discovered, and when these receptors were blocked by histamine antagonist, now what will happen? Histamine will not be able to act on its receptor, H2 receptor, because H2 receptor has been blocked by histamine receptor antagonist. The first class which are we going to discuss is H2 receptor antagonist, and when this H2 receptor will be blocked, now histamine will not be able to act on it, and this pathway will not start. Insulin will not be phosphorylated. These proton pump will not fuse with the cell membrane of the parietal, and the acid secretion will not increase. It will be inhibited relatively. So basically, by blocking the histamine receptor, the secretion of acid will reduce. And if you talk about the examples include cimetidine, example include famotidine, and example include ranitidine. If we talk about the pharmacology, they are considered as a safe drug. They do not have any kind of severe adverse drug reaction, but they may cause some problem like related to GIT, nausea and vomiting. They can also cause dizziness as well. And if we talk about the interaction, we should not give this drug with along with the antacid. Antacid basically reduce the absorption of these H2 receptor antagonists. So if you want to give an antacid with the H2 receptor, you should not take both these drugs at the same time. Okay, so because they can interact. Now let's talk about the second class of drug, that is proton pump inhibitors. Proton pump inhibitors were discovered in 1989, and the first drug that was discovered, it was omeprazole. Proton pump inhibitor basically block the terminal step of acid secretion, the last step of acid secretion. They will block this proton pump. Here you can see histamine receptor antagonist, they were blocking the very initial steps. Okay, but proton pump inhibitor basically will block the last step. They will block this receptor. Okay, and when this receptor will be blocked, what will happen? This receptor will not be able to function properly. Acid secretion will not take place, and acid secretion will be reduced. Now what will happen? These drugs are basically pro-drug. It means they will get activated when they will get into our body. So after getting into our body, in the acidic pH, these proton pump inhibitors, these drugs, they will get activated, and once these drugs will activated, these drugs will make a disulfide bond with the proton pump inhibitor. It means these drugs will attach with the proton pump, potassium hydrogen ATPase pump, with the help of disulfide bond. And when these drugs will attach with the proton pump, now proton pump will not be able to perform its function properly, and the secretion of hydrogen ion, or we can see the secretion of acid, will reduce. So in this way, proton pump also reduce the acid secretion. Omeprazole, as I have talked about, it was a first drug that was discovered, then pantoprazole, then lansoprazole, and then rabeprazole were discovered. Rabeprazole is having a very fast and rapid action of lowering the gastric pH, by increasing the gastric pH. And lansoprazole is basically considered as safe drug in pregnancy. So it means if we want to give proton pump inhibitor in pregnant ladies, we should give lansoprazole. Okay, now let's talk about the third drug, that is third class, that is antacids, okay, and which include aluminium hydroxide and calcium hydroxide. By looking at the hydroxide, you can see that these drugs are basically alkaline in nature. So what will happen, these drugs will directly get enter into the, after oral administration, when they will get enter into the stomach, so they will directly react with acid and they will form salt plus water. So it means they are directly neutralizing the acidic effect of HCl by converting it into a salt, and we know that salt is a neutral entity. Okay, so similarly aluminium hydroxide and calcium hydroxide will form calcium oxide and calcium chloride and aluminium chloride respectively, that is salt, and they will neutralize the acidic effect. For the immediate effect, we can give antacid. Obviously, proton pump inhibitor and H2 receptor antagonist, they will not produce immediate effect. For the immediate effect, antacids can be used. Okay. Now let's talk about the other class of drug, that is protectants. And here are the examples: sucralfate and bismuth subsalicylate. Okay, sucralfate basically made a ulcer adherence complex. It form a ulcer adherent complex with the exudate of the ulcer, the site on which ulcer has been taken place. You know that at that particular site exudate will come out. Exudate is basically a proteinous fluid that come out at the site of ulcer in response to inflammation. Okay, in response to inflammation, and that is a proteinous fluid that is present at the site of ulcer. Okay, now this sucralfate, it will bind, it will attach with the protein that are present in the exudate, and it will make a protective coating. It will make a protective coating and it will help in the healing of ulcer. It will protect in the healing of ulcer. Now bismuth subsalicylate, it also have protective effect. So it means it will make a protective layer on the ulcer, and it can also neutralize, it have also capability to neutralize the endotoxin produced by the E. coli. With the help of this subsalicylate group, it has capacity to neutralize the endotoxin produced by the E. coli and other bacteria, and it can also inhibit the pepsin. We know that pepsin is basically an enzyme that can digest protein. Okay, the food we eat will be having protein in it, and that protein will be digested with the help of enzyme pepsin. Okay, but in some condition, when the pepsin concentration will increase, you know that with the help of HCl, pepsinogen will be converted into pepsin. And if the HCl concentration has been increased, the more and more pepsinogen will be converted into pepsin. And when the concentration, the amount of pepsin will increase, it will start digesting our cells protein as well, our GIT cells protein, our stomach cells protein as well. So this pepsin will start damaging the epithelial cells of the GIT. So this bismuth subsalicylate has also capacity to inhibit the pepsin as well. And furthermore, we know that this pepsin can convert protein into amino acid. It can break down the protein, and those amino acid can act on the GIT, can stimulate G cells to produce more gastrin. And when there will be more gastrin, in return, you know that gastrin will act on receptor present on the parietal cell, and more acid will be released. So we can say that pepsin can increase acid secretion as well. How? I will repeat. Pepsin, it will convert protein into amino acid. Amino acid will stimulate G cells to produce gastrin. Gastrin will be having its receptor present on the parietal cell, and it will increase acid secretion. Okay, CCK receptor will be present for the gastrin. Well, gastrin will act on it it will increase acid secretion. Okay, so in this way, bismuth subsalicylate is also inhibiting pepsin, or directly it is also inhibiting the acid secretion as well. Okay, the next class is analogues of prostaglandins. The analogues of prostaglandin include example misoprostol. Okay, misoprostol, it's a basically synthetic analog of prostaglandin. So obviously it will act on its receptor, prostaglandin receptor that are present on the mucous cells or alveolar cell, or it will also act on its receptor present on the parietal cell, EP3 receptors. When it will act on its receptor, okay, so here is a bigger picture of parietal cell. So let's talk when misoprostol will act on its receptor on the parietal cell. So this prostaglandin receptor is basically linked with G inhibitory protein. So it means it will inhibit adenyl cyclase activation. It means now adenyl cyclase activation will not take place, ATP will not convert into cyclic AMP level will remain low, protein kinase activation will not take place, phosphorylation of ethanol will not take place, ethanol will not be able to fuse these tubulovesicle with the cell membrane, so there will be very low sodium potassium ATPase pump, and there will be very low secretion of hydrogen ion or acid. So it means prostaglandin is basically inhibiting the acid secretion. So by giving the analog of prostaglandin, we can inhibit the gastric acid secretion from the parietal cell. At the same time, when these prostaglandin analogs like misoprostol, when they will act on their receptor present on the alveolar cells or present on the mucous cell, they will increase the secretion of bicarbonate and they will increase the secretion of mucus from the alveolar cell or the mucous cell, and the mucus will make a protective covering over the cell and inhibit the gastric epithelial cell from the harmful acidic effect, and bicarbonate ion has the capacity to neutralize the HCl present in the stomach. Okay, so in this way prostaglandin analog, they can decrease acid secretion and they can also have protective effect as well by increasing mucus and by increasing bicarbonate secretion. Now let's talk about the sixth class, that is antibiotics. Obviously, if there is a H. pylori induced ulcer, we have to give some kind of antibiotics, and for this amoxicillin, metronidazole, clarithromycin and tetracycline, these are the some kind of antibiotics that has been proved very effective against the H. pylori bacteria. So these antibiotics can also be given. The detail of antibiotics and their mechanism will be discussed in a separate class, and I will discuss the mechanism of all the antibiotics in the pharmacology. Now there is another class, that is M3 antagonist, and example is pyrazapine. M3 receptor antagonist, I have explained that parietal cell can secrete acid in response to acetylcholine. Similarly, these enterochromaffin cell, they also secrete histamine in response to acetylcholine, and this histamine will further provoke parietal cell to secrete more and more acid. So if we block these histamine receptor, gastric acid secretion can be reduced. Okay, so here you can see basically when acetylcholine will act on its receptor present on the parietal cell with a cellular signaling pathway, they are basically causing the phosphorylation of ethanol protein, and or they are basically increasing the number of proton pump on the luminal side. Okay, or they are basically increasing the acid secretion. So if we block these acetylcholine receptors, are basically M3 receptors, these are M3 receptors, and if these receptors are blocked by giving M3 receptor antagonist, obviously gastric acid secretion can be reduced, and the example is pyrazapine. Okay, now let's talk about a very important FDA approved triple therapy for the treatment of gastric ulcer, and this therapy is given for approximately 7 days, and in this therapy proton pump inhibitor should be given, BD, like twice a day, in the morning and in the evening, proton pump inhibitor, plus clarithromycin should be given, plus another antibiotic which may include amoxicillin or metronidazole can be given. This is called as a triple therapy for the gastric ulcer, which include one proton pump inhibitor and two antibiotics. There is another important therapy, that is quadruple therapy. Quadruple, which include four drugs, okay, and that is not basically FDA approved, and which include bismuth subsalicylate, which include proton pump inhibitor, and which include clarithromycin and tetracycline. So these are the combination of four drugs that come into the quadruple therapy, but this is not FDA approved, but this triple therapy is FDA approved for the treatment of peptic ulcer disease. I hope you must like this video. Please don't forget to subscribe my channel and press the bell icon, and don't forget to share this video with your colleague as well. Please don't forget to press the bell icon so that you may get notification for the future videos. Thank you so much.